I'm so angry that we're in 2025 and you and I are sitting here talking about this and people still don't get it and they're still scared of estrogen and they still haven't read Estrogen Matters and they still haven't seen Avrum Bluming's work, and he's published so many papers and he's been on so many. I keep trying to get him on my podcast. Maybe you can hook me up with him. I just think that this is just such an untold story, and a whole 2 generations of women have been completely screwed over because of it.
Well, and it's interesting because I think about my mom's generation. And so my mom has 3 sisters and my dad had 1 sister. So all my aunts have kind of given me permission to kind of talk around what they've experienced. But, you know, for me, like watching my mom go from being on HRT and she never had any joint problems to suddenly being debilitated with osteoarthritic symptoms, which wasn't osteoarthritis. It was this loss of estrogen.
Yep.
So painful. They put her on COX-2 inhibitors, which ironically enough got pulled off the market. She was on Vioxx.
Wow.
She had so much pain in her feet and her hands that she could barely function. And she was like, I know enough not to take anti-inflammatories habitually, but she's like, I have to be able to function. She was at University of Pennsylvania. And, you know, for me, it's like looking at the neurocognitive decline that I see in loved ones, which I find so troubling because I know for myself, I tell my husband and my boys, I'm like, I never want to be a burden. I think every person out there doesn't want to be a burden to their family. But I'm like, it's one thing if I like suddenly like break a bone. It's totally different if suddenly I am on that neurocognitive decline and I'm at risk. Like my stepmother had end-stage Alzheimer's, and the entire unit that she was in, which was a very small, lovely unit, 95% of them were women.
Can you imagine if we could give all those women B12, thyroid, and estrogen?
They would have not been there. Like my stepmother would look at me and she would say, I know something's not right with my brain. It was one of the saddest. It was like this total regression in her memory. And they would keep adjusting her medicines. And I'm like, you realize now the research actually supports what you're giving her. It just makes you feel better to put her on something when what her brain needed all those years was estrogen.
It's enraging and heartbreaking. And I didn't even have that low of a level, and I was having that kind of pain. And I was using topical estrogen cream, and it just wasn't, I was being kind of mamsy-pamsy about where and when and timing of it. And that all matters. And I finally just slapped a patch on just to see what would happen. All the pain went away, like bone splitting spinal pain that I can't even describe, to the point where I was telling my husband, like, if this is how bad it is right now, how am I going to deal with this when I'm 80? Like, how am I going to survive this? And just shifting from the topical, I'm still menstruating normally. I am in allopathic medicine. I would not be a candidate for any of this, but you and I know better, right? We supplement the physiologic dosing that needs to happen. And I couldn't believe just getting steady state estrogen. So, I mean, that's even another layer of the complexity of this, is like having a practitioner because I know practitioners who are not willing to go outside of the creams. And
not everyone absorbs them. So let's be clear, like not everyone absorbs. So I take oral compounded progesterone because I need the sustained effects. I have an estrogen patch. It is the greatest thing known to man. Yes. I had compounded estrogen, but I just wasn't absorbing it. But now it's so nice. It's like twice a week, Monday and Friday. I take my patch off. I put a new patch on. And for me, what was interesting was when I would say to people, I don't really get a lot of symptoms, I feel much more mentally sharp. I don't think I even realized until we did labs, and I looked at my labs and was like, I have like an imperceptible amount of estrogen on board. We need to do something else. And then I use compounded testosterone. But for me, the difference for a patch versus compounded for me personally was so significant, because as a podcast host, you understand this, as someone who's online, it's like, you don't want to be thinking like struggling with words, like word finding, that's scary. And so I definitely, like, retrospectively, I'm like, holy cow, it's like a little light bulb got turned back on brighter in my brain. I was like, oh, this is a good thing. So I think the point I'm trying to make, and I think both of us are making, is that everyone needs a little bit different. Working with someone that is willing to take the time to do a little bit of experimentation. Because for me, I think I was so fixated on, oh my God, there's something wrong with taking a patch. No, there's absolutely, it's cheap. Like, I think I just paid $15 for 3 months of patches. And I was paying, I don't know, $100 a month for a tube of estrogen that was compounded. It wasn't working for me. And if it works for you, that's great. It wasn't working for me. But having said that, if you can take oral micronized, immediate release progesterone that's covered by insurance and is dirt cheap, check box. Same thing with those estrogen patches. Works for you, check box. I think that's awesome. I think that each one of us might need something slightly different, but I can tell you that world of difference on an estrogen patch. I'm like raw estrogen patches. It's super convenient.
And for those listening who whenever I talk about this stuff, I get bombarded with messages from women saying, how do I find a good doctor? My doctor won't do that. Find a new doctor. You have to I have a whole free video on my website called How to Find a Good Doc. Mm-hmm. And it's right there in the menu. You have to do some legwork and you have to find someone. The more we talk about this, the more that we share out, the book, we've got a whole army of women now talking about this, female doctors. We've got Dr. Mary Claire and her best-selling book. We've got your book coming out. We've got a lot of people talking about this. My goal in 2025 is that I expect all doctors to do better. I want all of the people listening who are patients to go in and demand that their doctors do better. And if it doesn't work, go find a new doctor. And you probably will have to pay out of pocket, and that is okay. It is the best money you'll spend. So us educating people, and those people actually, it's an army. It's a group effort. We have to get because these doctors have to go learn this stuff. The reason doctors don't want to do this stuff is because they don't want to run the labs, because if whatever they find on the lab, they're responsible for managing, and they don't know how to manage a lot of these conditions, or they don't want to get into it. And that's okay. Maybe that's not how their practice is set up. You can't expect a general practitioner who's only getting paid to see patients for 5 minutes to really be able to handle this stuff. You have to go find somebody who this is what they do all day, right? So to the patients listening, just understand how the system works and go find some people that you can work with who are savvy to this and who are willing to help you. And ask your girlfriends. Go find your hottest middle-aged girlfriend. And trust me, she's hooked up.
She's taking HRT. Trust me. Trust me.
Yes. Go find your hottest 50-year-old girlfriend and be like, who are you seeing? Yeah. and go see them and spend the money and get it handled, because it's life-changing to have your brain come back.